Hello, my name is Peter Lawrence, and I'm pleased to introduce the July issue of the Journal of Vascular Surgery, Venous and Lymphatic Disorders, and highlight 4 outstanding papers that are freely available for the next 2 months. The CME article for this issue, as shown in this slide, is called Radiofrequency and Laser Ablation for Patients on Warfarin Anticoagulation is Safe, Effective, and Durable, by Weston and co-authors. Since there's been debate about the indications and results in patients who undergo thermal ablation while on oral anticoagulation, the authors did a retrospective study of over 200 procedures on patients, with approximately half of them anticoagulated and a half of them serving as controls. Most patients took the warfarin for atrial fibrillation, but others were taking the warfarin for a prior history of DVT and other diseases unrelated to varicose veins. They found that thermal ablation with either a laser or radiofrequency catheter had no higher early risk of bleeding or failure to close the vein. And in long-term follow-up, the closure rate was comparable in both at more than 90%. The authors concluded that warfarin use should not be a contraindication to varicose vein treatment, since the early and long-term results are similar, and that warfarin does not need to be bridged or discontinued prior to the procedure. Our next highlighted article is one of the editor's choices for this issue, entitled The 2020 Appropriate Use Criteria for Chronic Lower Extremity Venous Disease of the American Venous Forum, the Society for Vascular Surgery, and the American Vein and Lymphatic Society, as well as the Society for Interventional Radiology. Everyone who performs venous procedures for chronic venous disease should read this paper. Masuda and co-authors used a validated method for determining appropriate use criteria, often called AUCs, for elective venous procedures. These criteria were developed following several papers published in the JVS-VL showing that there were some physicians who were performing a very high number of venous procedures per patient, and that some of these procedures were probably inappropriate. The authors used the RAND UCLA validated technique to develop AUCs. They concluded that superficial and venous procedures are not indicated in asymptomatic patients except for some special circumstances, and that appropriateness criteria in patients with CEAP 2 to 6 disease differ depending on whether the vein is a superficial truncal vein, a perforator vein, or an iliac vein. The third article is another editor's choice by Lawrence and co-authors, and is entitled Treatment of Superficial and Perforator Reflux and Deep Venous Stenosis Improves Healing of Chronic Venous Leg Ulcers. This multi-institutional study used a standardized database to evaluate the contributions of various methods of treating patients with chronic venous ulcers. They found, as shown in this slide, that compression alone heals over to 70% of venous ulcers. Venous ulcers that remain unhealed in each procedure, whether it be incompetent superficial vein ablation, incompetent perforator vein ablation, or iliac vein stenosis stenting, contributes to venous ulcer healing. And if all modalities are used, over 85% of venous ulcers not healed by compression alone will heal. The authors also stated that the sequence of treatment remains to be elucidated, since each institution who participated in this study used a different sequence of procedures for ulcer treatment. The final article highlighted this month is In-Hospital Outcomes of Catheter-Directed Thrombolysis versus Anticoagulation in Cancer Patients with Proximal Deep Venous Thrombosis by Bolofsky and colleagues. They used the National Inpatient Survey to determine the outcome of patients with cancer who developed proximal DVT and were treated in the hospital. They found that the mortality of the 2 treatment options was similar, but that patients who underwent lysis had a significantly greater risk of bleeding. The authors concluded that each treatment option was appropriate for some patients, but if catheter-directed thrombolysis was elected, it should be performed in patients with a low bleeding risk. Thank you for watching. For more information, please follow us on social media, and remember that to like, comment, and share. We hope you enjoy these 4 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery, Venous and Lymphatic Disorders. Remember that these articles are free to read until the end of August. And thank you for your attention.